Welcome back for more Real Life. How would you like to help someone recover from an injury or disability so they can get on with their life? If you are interested in the health field and would like to improve or restore someone's mobility and motor skills, you might consider a career in physical therapy. Recently, Gracie spoke with Caitlin Hambridge, a physical therapist at the Institute for Advanced Medicine in Sarasota, Florida. As she found out, it takes a person with a lot of patience, empathy, and problem-solving skills to be in this rewarding profession. We're here with Caitlin Hambridge, physical therapist. Caitlin, what do you do every day as a PT?
Every day is pretty much different here. It just depends on the patient caseload. So I typically see a range from patients who have had strokes, traumatic brain injury patients, a lot of Parkinson's disease, neuropathy, balance patients, dizzy patients, just all depends on the day.
What is the difference between a PT and an OT?
A PT generally focuses on some of the balance, walking, mobility. In the neuro realm of things, what I do here, the PT generally focuses on the lower extremity. And then the OT is going to focus more on fine motor skills, activities of daily living. They may focus on the upper extremity just so we have more time to deal with the patient.
What are the educational requirements to be a PT?
Most of the education now for a PT has moved to the doctorate level. So I did 4 years of undergraduate work. My bachelor's is in exercise science, and then 3 years of graduate work, and then graduated with my doctorate in physical therapy.
Do you have to have internships along the way?
You do. The program that I graduated from, we did 52 weeks worth of clinical work. So there was quite a lot of experience.
Wow. Sounds like you really have to be dedicated.
You do. But you have a lot of experience to figure out if it's really for you along the way.
What's your favorite part of your job?
My favorite part is how rewarding it is to have the patients come back to you and say, I was able to do this for the first time, or I was able to pick up my grandchild, or walk down the aisle at my daughter's wedding, things like that.
What would be some typical exercises?
Again, it's all based on what is going on with them at that time. So it could be someone that we're teaching them how to walk again, or it could be as high level as they used to be a great tennis player and had some kind of balance impairment, and we're getting them back to the tennis court by actually practicing that activity.
How long are the sessions normally?
An hour. They're all an hour one-on-one at this facility, so it's great. You have a lot of time to spend with your patient.
And how long do you usually treat a patient?
It varies. It can be as short of a time period as 2 or 3 weeks, or it could be up to 6 months or so. It's all based on what they need, how they're making progress, and how we reach their goals.
Is there any advice that you would have for someone that was interested in maybe entering the field of physical therapy?
I think try to make sure you get as much experience as you can. So once you enter school, it's quite a commitment. So going and seeing if you could shadow with local therapists, local clinics, and then maybe exploring everything else in the medical field just to make sure that what you commit to is the right fit.
Do all physical therapists work within a hospital setting?
No, physical therapy can be done in a wide range of settings, something that I wasn't really aware of when I went to school. I was thinking that all physical therapists worked in an outpatient orthopedic setting with athletes and things like that, but you can do everything from home care, school settings with children. You can do acute care hospitals, nursing homes, and then also outpatient clinics.
Why did you choose this form of physical therapy?
I felt that this form was really challenging, that there was, like I said, every day is different. I never know quite what to expect from my patients, so it keeps me on my toes. This facility is great because we have access to OTs, speech therapists. We all work very well together. We have access to the whole gym facility as well.
What types of skills do you feel are necessary for this job?
You definitely have to be a people person, I think. You have to want to help people and to be able to interact with a wide array of personalities and kind of be up for whatever is thrown your way. You have to be dedicated to your schooling. It definitely is a long road. And you also have to really want to be able to continue your education and keep learning, because it's not done once you graduate from school. You need to keep going, keep getting your continuing education and things like that.
Caitlin, thank you so much for sharing about your job and teaching us a little bit more about what it takes to be a PT.
You're welcome, my pleasure.
Physical therapists work with a variety of patients, including young children with congenital disabilities, people with sports injuries, or who were in auto accidents, and those with neurological diseases like Caitlin treats. Though it wasn't required a few years ago, a doctoral degree is now necessary to be a physical therapist. All states require physical therapists to be licensed. Licensing requirements vary by state. Don't want to commit to getting a doctorate in PT? You can also look into becoming a physical therapy assistant. This career requires less education, and you would then work under the direction of a physical therapist. Most states require PTAs to be licensed, registered, or certified. Check out today's episode synopsis at rl101.com for a link to the American Physical Therapy Association's website to learn more about careers in this field.
We have more for you after this break.